Hey, it's time for our Tuesday checkup.
Doctor, give me the news.
And now it's time for your Tuesday checkup. Thanks to Sydney Adventist Hospital, harnessing the latest advancements in health while giving you the attention, respect and care you deserve.
Okay, guys, now breathe in and hope the doctor's warmed up his hands because we're going to be talking about something, well, it's a little bit awkward for some of us. Prostates. I had a prostate check myself recently. It was on live television. I later found out you could just get a blood test. Anyway, prostate cancer is the most commonly diagnosed cancer among Aussie men. It claimed the life of my very, very dear friend. I'm still in denial about it, but John O'Coleman died a couple of years back, and I still can't quite get over it. But anyway, it is something really serious, and we do need to talk about it. So in this Tuesday checkup, we're going to speak with leading urologist Dr. James Symons from the Sydney Adventist Hospital, who are harnessing the latest advancement in health while giving you the attention, respect and care you deserve. So if you've got any questions about prostate cancer or anything else about urology, which is your kidneys and your bladder, give us a call now, 131 873. The phone line's already flashing, so make sure you get in, 131 873. And Dr. Symons joins us now. G'day, Doctor. Welcome to Afternoons.
Hi, Joe. Thanks for the opportunity to talk to you.
Absolute pleasure. Look, as I mentioned, this is something that is close to my heart. John O was probably the first person we have parents and grandparents and relatives that die. He was the first sort of real mate of mine that died. We hear a lot about prostate cancer because it is the most diagnosed cancer among Australian men, but it can be awkward to talk about, can't it, even with our doctors? So
absolutely.
How do we know if we're at risk and how do we have those conversations? Do we just sort of go and then point or what? What do we do?
Well, reality, all men in Australia are going to be at risk of prostate cancer at some stage over their lives. It increases as you get older. So for men in their 30s and 40s, it's not normally going to be something to worry about. But the risk really starts to pick up once people are over the age of 50. So men should have a solid chat with their GPs, amongst other health issues, from the age of 50. And then there's a role for screening tests, as you mentioned, with blood tests or otherwise, as you move forwards from 50 into later life.
And I've got to say, this is a true story, but I think Studio 10 was just an elaborately arranged hoax to humiliate me before the nation. But I actually did get a physical prostate check on live television, and
Hopefully not too bad a feeling for
it was,
you.
It was absolutely, you know what? It was absolutely fine, and I'm not going to pretend that it was terrible and invasive and awful because it's a very vital service and it was actually not that uncomfortable before. But it can be even more comfortable because you can get a blood test, as you mentioned, can't you? So even if you're feeling a bit funny about that.
Look, absolutely. The two dovetail. One doesn't replace the other.
Right.
And so I think that's a common misconception, is that the blood test is a way to replace an examination or replace a review if the blood tests are abnormal. But certainly the blood test is the sort of PSA test, the blood test that you're talking about,
Yep.
is good to get a baseline level of risk for the men out there, and that can then be followed up with your local doctor or with a specialist with a finger examination, which most patients will then say is nowhere near as bad as they thought it might have been.
You know what? I actually feel better about that now because I think, well, you know what? I've gone from suffering in vain to being a flag bearer and a national hero. So there you go. And it isn't that bad at all. It's absolutely fine. Richard from Oyster Bay is on the line. G'day, Richard.
Oh, g'day, Joe, and hi, Dr. James.
Hi, Richard.
I've got a swollen prostate, and I'm just wondering, is there any other physical exercise I can do to sort of relieve the symptoms, like the not being able to urinate completely, having the feeling that there is actually some urine there, but there's nothing, and you constantly stand at the toilet waiting, and then you think you're finished, and you walk off, and it downward dribbles all down your leg.
Look, that's a great question. It's a very common problem that I'll see amongst my patients, and then people will be complaining about it across the country. There's no easy answer to it. So the exercises that you're asking about don't exist directly. But certainly there's a role for pelvic floor exercises to really tighten up some of those muscles below the prostate, which can help you to hold on to your urine and help to retrain the bladder so that you can try and stretch out the trips to the toilet. The other sort of elephant in the room, which a lot of people aren't necessarily aware of, is the clear link between, I don't know what you look like over the phone, but the clear link between a little bit of weight around the middle and the pressure that then puts onto the bladder as well. So a lot of men, as they move through the years, will start to put on a little bit around the waistline, and that has significant effects upon how a man can hold on to their urine. It also increases a person's prostate cancer risk actually as well.
There you go. That's very interesting. I hope that was helpful for you, Richard. 131873 is the number if you've got any questions about prostate cancer or anything urological. People often say to me, Joe, you're a logical guy. And I say, yes, I am. That was interesting, Dr. James, you mentioned, so pelvic floor exercises can be useful for blokes as well, because I know a lot of women who have had kids, their pelvic floor can, they can benefit from doing pelvic floor exercises. I know Sarah Harris benefits from it enormously because my jokes are so funny that often it can be a real risk. With her pelvic floor, and so blokes can do it as well.
Yeah, no, absolutely. Look, blokes don't have the same sort of stretching that happens if women have carried babies, but as men get older, their pelvic floor weakens. A man in their 50s, 60s isn't necessarily got as much muscle around the place as somebody in their 20s and 30s.
Yep.
And they can get a little bit of weakness in the pelvic floor. So there's definitely a role to try and strengthen those up with dedicated exercises. And the physios, particularly those who have a dedicated interest in the pelvic floor exercises, can assess men and do some real-time ultrasound. They can make sure that men are engaging the muscles that they think they should be engaging, not just the ones that you in your head think. It's not just a matter of squeezing up and holding on as tight as you can.
Yeah.
And we also do it for men after they've had prostate operations. So there's a role for men before an operation or after an operation, or if they might have had some ray treatment, to try and retrain those muscles as well.
There you go. You learn something every day. Mark from Barella's online. G'day, Mark.
G'day, Joe. How are you?
Yeah, really good. Thank you, mate. What would you like to ask Dr. James?
Yes, good afternoon, Dr. James.
Hi, Mark.
Been recently diagnosed with enlarged prostate. And the doctors put me on tamsulosin.
Yes, very common treatment.
Yep, which has fixed the problem. It's working very good. But he asked me on my last appointment there, do I have a cataract? Which I do, and I will be facing cataract surgery further down the track. I have an eye condition, so they'll put the cataract surgery off for as long as possible.
Yes.
My question is, apparently there's some problem with this medication. Would I be told to stop this a couple of weeks before, or is it possible that they say don't take it at all?
Look, this is actually a really, really good question. It's still a little bit controversial. And the answer is it shouldn't be an issue. So tamsulosin, which is this medication that you're taking, it's been the mainstay of the medical treatment of men with a large prostate. So as the prostate gets larger, it's not just the gland, it's the muscles within it that start to become a bit overactive. And the tamsulosin falls into a category of medication called alpha blockers, and they will make muscles floppy. So it makes the blood vessels a bit floppy, which is why you can get a bit of low blood pressure with it. It can make the ejaculatory duct not work, which is why some men can get an alteration in their ejaculation when they're on it. It makes the bladder pass through this floppier prostate more easily. It also makes the muscles in the eye a little bit floppy, and you can get what's called a floppy iris syndrome, which has no bearing in day-to-day life. So if you look at a man, you can't tell that the iris, the muscles around are a little bit floppy. But when an ophthalmologist is doing an operation to try and fix a cataract, then they need to be doing some really precise maneuvers to safely go extracting the cataract and putting a new one in. There's a lot of different ways to skin a cat, and there's a lot of different ways to go doing prostate operations. There's a lot of different ways to go doing a cataract operation. Not all cataract operations, the ophthalmologists, the surgeons, are trained to go doing things the same way. And that Flomaxtra can make the eye a little bit harder to operate on using a certain technique. And all you have to do, because it's very safe to go taking it, is flag it with the ophthalmologist that might be treating you and say, well, can you do this on this operation? Or do I need to see someone who's got some VR training? So not all the ophthalmologists have VR training. But if they are, then your type of surgery should be a relatively straightforward one for them to go doing.
Great. I feel like I could do the operation myself now after that answer. That was fantastic. Very thorough. Thank you very much, Dr. James. Stay on the line. Plenty more calls coming through. We're going to take a quick break and we'll get to them. Don't go anywhere.
Did you?
Anyway, okay, let's get back to Dr. James, and Steve from Penrith is on the line. G'day, Steve. How are you, mate?
Good afternoon, Joe. How are you going?
Yeah, good, thank you, sir.
My question for a doctor is I've been diagnosed with prostate cancer. The doctor has said alternative surgery or radiation, but I've also read about high-intensity, I think it's called high-intensity focused ultrasound. Do you have any ideas on that?
Yes, I do. Like, high-intensity focused ultrasound is something that was used previously to try and treat the whole gland within prostates who were enlarged, so that the swollen prostate. And there's been moves afoot to try and repurpose that technology to do what's called focal therapy. And it's still sitting within the experimental stages. So it's starting to be used in some locations overseas. I'm not aware of anybody using HIFU, which is what this treatment is, inside Australia yet, and certainly not outside of a clinical trial. In general, for people who have more aggressive prostate cancers, then they need whole gland treatment rather than a focal treatment, which is just going to be targeting a small group of cells.
There you go. I hope that's helpful for you, Steve. Greg from Bankstown is on the line. G'day, Greg.
G'day, Joe. How are you today?
Yeah, good, champion. How are you?
Yeah, doing well, thanks. Just a little bit about me. I had an enlarged prostate for 15 years. 12 months ago, I was diagnosed with prostate cancer. I had an operation, radical prostatectomy, which is removal of the prostate. 61 years old, fairly fit, tradie, live life, do all my things. 12 months later, though, there's some ongoing issues with urinary incontinence. I was just wondering if what doctor says about that, Dr. James says about that writing itself, or if there's work I need to do, or what we might be able to go with that.
Yeah, fire away, Dr. James. What can you do?
Look, this comes back to the discussion of the pelvic floor exercises earlier. So I don't know. You said you're a fit bloke. Depends on how fit your pelvic floor is, and so the incontinence issue can be a bit of a bugbear for people who have prostate treatment. Once you get out to about a year, it's probably only affecting about 5% of people in a significant fashion. But for those patients, it really can be a bit of a bother. Tightening up those pelvic floor exercises can be a really useful tool for people to go doing. They can do it with a physio. And occasionally they may need to go down a path of some medical treatment with some pills to try and settle some bladder spasms down, or occasionally there are some operations that people can have done as an extra thing to just tighten up the pelvic floor a little bit more.
There you go, Greg. So there are things that can be done. Hope that works out for you, mate.
Certainly, if you're a young guy, there's no need to live like that.
Terrific.
There are things that can be done.
Great. Thank you very much, Greg. And thank you very much, Dr. James. It's been an absolute pleasure.
Pleasure.
And, of course, there's always one out there, isn't there, when you're talking